Welcome to our first European WM Patient Forum. Welcome to everyone that's in the room and to everybody that is online watching us as well. Someone once said to me that you don't have WM, Jane, so this is just a job to you. My mum was diagnosed with a rare breast cancer. She had chemo, she had surgery, she had more chemo, she had radiotherapy, she had a bit of a break, she had more chemo. She went on a clinical trial, she had palliative care. And whilst all this was going on, I was working for a company called Phones for You for a guy called John Cordwell. I ran a 150 million turnover account. I was the first female director in the business. And I so clearly remember sitting in a room with my mum one day, having chemo, with a wonderful team of nurses who were pretty much keeping our family together at that point, and just going, what am I doing with my time on this earth? Why am I trying to sell more top-up vouchers? And it was in that moment I knew that I wanted to make a difference. And so I moved over to the not-for-profit sector. I've worked at a couple of other charities and headed those. I then had a break from cancer for a bit. I set up a startup with my husband. And I guess I'm telling you all this to say it is not just a job. It's a privilege to me to be CEO of WMUK. There is no part of the cancer journey that I haven't experienced as a family member. I understand what it's like to sit in a room, in a waiting room, and no one else has the type of cancer that you have. I understand what it's like when new treatments come out, but not for the type of cancer that you have. I understand when there isn't information you can find on your cancer, apart from stuff that's on the internet that's quite scary and not very easy to read. And I tell you about my professional life because I'm not somebody who's very good at sitting still. In fact, I'm going to struggle to stand behind this lectern for a whole 10 minutes. I like to challenge, I like to make things happen. I'm not good at being told no. I always like to find a way of how we're going to do things. So I want you to know that I am very much in your corner. And this is not a job, and we are in this together. So this time last year, we met, and I said we're going to create a plan for WMUK. We did that. We spoke to everybody or emailed everyone who was on our database, and we said, what are your top 3 priorities? We took the findings of that into our strategy meetings, and we created a plan. And these are the 4 areas that WMUK now focus on. There is no one else in the UK doing what WMUK are doing. There are other blood cancer charities, but nobody is trying to improve the lives and improve patient outcomes and get more treatments for WM patients. You told us you wanted support when you needed it and in a way that you needed it, and you wanted more information about the disease that you could understand and easily access. You told us research was important. We know it's not a level playing field. We know people have many different experiences of being diagnosed, treated, and living with WM. And we want to address that inequality, and we want to get more treatments available, and we want to get a standard care pathway. And ultimately, sustainable funding. That is about making WMUK an organisation that outlasts any of us, that's always here for the future, always to support WM patients. So I'm on quite a tight time here because we're going to link up with Amsterdam soon, but I just want to give you a quick run through of some of the things we've been doing. And you're going to hear more about some of this stuff later today anyway. We launched the patient support line. That started as a few hours a week. That's now changed from being a part of somebody's job to becoming a full-time job, such as the demand for it. We've launched the patient advisory group, which I'm really excited about. And I think we've got some members of the group here today. Put your hand up if you're part of the patient advisory group. Oh, they're all in the back row, apart from here. Patient advisory group is really important to me because not only is it there to make sure the patient voice is always heard, it's there to hold us to account and make sure that WMUK are focusing on the things that matter to patients. So please take the time to connect with that group, speak to the members. And also outside of that group, always you can come and talk to myself, to Kat and to Alison, who are the 3 members of WMUK. In terms of information, you wanted more information. You've all got a newly diagnosed with WM booklet in your tote bags. Even if you're not newly diagnosed, I'd say take a look at it. It's a great resource. We've also produced, we have a general booklet for WMUK, and we have leaflets about the support lines as well. Oh, let me just move that microphone. There's a whole load of literature. One of the ways you can really help us is get that literature out there and take it to your local hospital. So please, again, feel free to contact us and ask for that. Coming up on the horizon, we have an A to Z guide of treatments for WM, which is much more extensive than what we currently have on the website. And there's also a symptoms guide. So we are in the process of building a library of expertise for you around WM. Research. You're going to hear a lot about this today. And I am so excited the people we have in the room to talk to you about this. We are collaborating with some of the best people in the industry. WM and me with Sunniest Health. Where's Orlando? There's Orlando. Orlando's the founder of Sunniest Health. Please go and ask him lots of questions today. He's really friendly. He's also got his team here, and they've got a stand in the refreshment area. And WM and Me is an app. And essentially, this is for us to collect everyday data about what's going on with you with WM. Even if you're on active monitoring, all you've got to do is wear a watch and answer a few questions each day. Having that data will make a massive difference to our understanding of the disease. And Charles, where's Charles? Right at the back, obviously. Charles is patient trustee. Charles has been trialling the app and wearing the watch for the last few weeks. So he's going to do an impromptu session at 1:10 back in here. If you want to see a bit more about it, he's going to show you the app, show you the watch, talk through how it's all worked, how it's worked for him, and just give you a bit more insight to it. But the whole Sunniest team are here as well. Then we have, where's Jonathan? All my speakers are at the back. Jonathan is here from Stitch. Jonathan's company have created a brilliant app for patients who are going on to a clinical trial to help them navigate their way through it. And I know without a doubt, having been a family member who's supported someone through a clinical trial and seeing this app, that patients will absolutely benefit from it. So Jonathan is going to tell us more about that. But again, feel free to go up and ask Jonathan questions throughout the day. Active monitoring guidelines. We know, as I said, there's a lot of disparity in WM. And this was a particular area where some patients went in, had a great experience, understood why they were on active monitoring, understood what it meant, felt reassured, felt confident. Lots of other patients came out a bit confused, felt like, I've just been told I've been given incurable cancer, but I'm not being treated, really struggled with anxiety, really struggled to really go about their lives as normal. So delighted that we've worked with pharma on this initiative to produce essentially guidelines and a checklist which is available for patients and for clinicians, and anybody in WM now who will be put onto active monitoring will get the chance to go through this checklist with their clinician. And I think it will lead to everybody feeling more in control and less stressed and more informed about this. And Shirley is going to take a session on active monitoring a bit later and tell you more about it. And finally, virtual MDT. We know there's pockets of deep knowledge about WM, but there's also lots of consultants who may only see 1 or 2 cases of WM, in their lifetimes, once or twice. Excuse me. So we're trying to disseminate that knowledge. This essentially will mean consultants can bring their case of WM to an expert panel who can then share their wisdom, their advice, their experience of treating. And what it will do is raise the whole bar of treating WM. And this is something that's going to launch early next year. So we need your support. I know this is the slide where everyone goes, now they're going to ask me for money. We obviously do need money. We get nothing from the government. We get no statutory grants. Every penny that we have to be able to do the work that I've just shown some of you in a nutshell relies on donations. But support can mean many different things. Some of you will see patient videos throughout the day, and Vern is actually here to take part in one of our sessions who did the videos. Those people gave up their time to come and be interviewed, to be filmed, to help us show there's many different faces of WM. It's not just a disease of white male 60 plus. Some people cycled London to Paris recently, raised £70,000. Amazing. Some people made pottery and sold it. Some people just help us by taking leaflets into their local hospital. So Justin is here today. I can see you. Justin is working with us to help to make sure our fundraising is sustainable. He's just really interested to talk to any of you today about your experience of WMUK, what you think of us, and the ways in which you may be interested in supporting us. So again, he's a really friendly guy. Talk to Justin. So I guess my message to leave you with is we are a community. I'm really proud of that community that we have built. We are all in it together. We are stronger together. But we truly believe the best advocate for your own healthcare is yourself. And WMUK's job is here to make you be the best informed, educated, confident advocate for yourself that you can be.